Welcome to our new PEP Talks series called Beyond the Barriers, exploring what patient access really means at Moffitt Cancer Center. At Moffitt, access isn't just about opening doors, it's about removing barriers. Whether those barriers are language, disability, housing insecurity, financial hardship, religious needs, or something invisible beneath the surface, we believe every patient deserves the same level of care, dignity, and hope. In this series, you'll hear from the people working behind the scenes and at the bedside to ensure that no matter what challenges a patient carries with them, they receive care that is equitable, compassionate, and deeply human. Because at Moffitt, one person can make a difference, and access means everyone belongs here. In this first episode of Beyond the Barriers, our host Charlie Agurcia sits down with Prado Antolino, Director of Language and Communication Access at Moffitt. For more than 22 years, Prado and her team have worked to ensure that patients who face language barriers, whether they speak Spanish, an indigenous dialect, or a language spoken only by a few thousand people in the world, are not just translated, but truly understood. This conversation goes beyond interpreters and legal requirements. It's about heart. It's about dignity. It's about the moment a patient hears their own language spoken in the room and sits up with hope. Because communication isn't just clinical. Sometimes it's therapeutic, and sometimes it's life-saving.
Welcome back to PEP Talks. My name is Charlie Agurcia. I'm from the Patient Family Advisory Council, and I am here to interview Prado Antolino, who is going to tell us all about her amazing work that she does at the Language and Access Services Office. So, tell us a bit about yourself, please.
Thank you, Charlie. Thank you for the invitation. How fun to be here with you, and thanks for the opportunity. So I run the Language and Communication Access Department at Moffitt. I have been here for 22 years, and I work with a wonderful team of professionals, coordinators, interpreters, and others and translators whose main job is to bring down whatever barriers patients have to access care at Moffitt in a way that is equitable and as meaningful as what any other patient would get at Moffitt.
In a more personal level, what does access mean to you for patients?
English is my second language. I came into the United States many years ago. I relate to the experience of the non-English speaking patient in a very personal manner, but obviously patients have other circumstances and factors surrounding them. For me, access is to be able to come to Moffitt because Moffitt is the right place for you to take care of your particular disease, and that you are able to come through the doors with no obstacles of any kind. So that if you don't speak English, if you are deaf, if you have visual deficits, if you have intellectual disabilities, or otherwise, whatever that may be, or perhaps you are housing insecure, perhaps you have financial trouble, that you can come to Moffitt to take care of your cancer the same way that any other patient who does not have any of those circumstances surrounding them.
That's fantastic. And so once you have these patients coming into those doors and you've eliminated these obstacles, how do you want them to feel?
I want them to feel cared for. I want them to feel that they are in the right place for them. I want them to feel that we are all treating them the same way that we would want our family members to be treated, the same way that we would want to be treated ourselves.
When I came into the double doors at Red Valet, I was pretty ill, but I definitely will never forget the feeling I had of feeling welcome and finally being in a place where I had hope of maybe getting better.
What was it about Moffitt that made you feel that way in that first impression? Can I turn?
Yeah, you can turn it around. Yeah. It was the international team. It was the way that they made me feel welcome and crossed all the T's and dotted all the I's before I even got here.
Yep.
And it was just such an incredible difference from where I've been treated before.
Wow, fantastic. You were in the best hands with them. I can vouch for that.
Nice. Well, with the passion that I hear in your voice, let me ask you, can you think of something recent, a recent experience with a patient where you were reaffirmed and you said, this is why I do this job?
I do. And I'm going to get a tiny bit emotional.
Go for it.
We have a patient who is young and came to Moffitt very sick, probably about a year ago now. And he speaks a language for which is difficult to find interpreters. He was being essentially kept alive by our unbelievable hematology team on weekly transfusions and so on. The patient speaks this particular language. We call them languages of lesser diffusion because there's not millions and millions of speakers of them around the world. But he also spoke some Spanish. So we could do a little bit of supplementing with our Spanish interpreters. At some point in trying to find interpreters for him and really going the extra mile and really exhausting all of the resources that I have at my disposal, we were able to actually accommodate this particular language need. And it became this beautiful sort of blossoming even within the team, because we were providing services through one of our language vendors. So by the time the patient comes to the clinic, there's probably about 15 emails that have been exchanged between the language services department, the provider, the language vendor. And so it just started to happen that the same interpreter would start accepting this case. This patient is very well known among our team. He has thrived throughout the entire experience. He, to my knowledge, is in remission. Recently, when the doctor told him that everything looked really fantastic from all the treatment parameters and so on, the Spanish interpreter that has been holding his hand, and there's two of them that I want to kind of give a shout out to, Jocelyn and Elisa, have really taken care of this patient from the Spanish perspective very, very closely. So he shared that the only reason why he was alive was because of course, the medical team, but he also acknowledged the language barrier and how we really had done so much to try and accommodate him and to make sure that also his siblings, who were of course being tapped to be his donors, one of his siblings did not speak any Spanish at all, but it became personal for all of us, for the language services team and even for this interpreter in the other company. And the patient was able to recognize that. This patient has a really, really soft spot. We have a very soft spot for him right now.
That's very nice. Well, in this process, for patients, who haven't accessed the Moffitt system yet, where does your team come into play? How does a patient who has barriers to access healthcare come into contact with you guys?
So, if the patient speaks a language other than English, usually at intake, our intake specialist will ask this question: in what language would you prefer to receive your medical information? And if the patient answers something other than English, then they get flagged. That language flag is shown on their chart. So when the patient presents either in the outpatient realm or in the inpatient setting, the nurse, the physician, the MA, the medical assistant will see the language flag, and they will know, the professional at Moffitt will know that they have to engage an interpreter. Interpreter services, I want to clarify, doesn't necessarily mean that the patient is going to get an in-person interpreter every time, but the patient will get an interpreter every time. So we have video interpreting, we have audio interpreting, and then we have in-person interpreting. My point being that any patient that walks through our doors with a language barrier, if that question has been answered correctly, by correctly I mean identifying themselves as a speaker of another language that's not English, then they should be getting access to interpreters. If the patient presents and nobody offers an interpreter to the patient, I always want to encourage patients to speak up for themselves, to advocate for themselves. And you probably know this very well as a patient, that you have had to do some level of self-advocacy at times. They should let us know what they need for their care. We never want to burden patients with that. I want to make that very clear. The onus is not on the patient, the burden is not on the patient, but the patient can advocate for themselves. So that's how the patient and us come into contact.
All right. As a patient, I have to say that one of the things that I did appreciate about Moffitt, and was always stood out during my treatment, was how Moffitt empowered me to help me make my own decisions.
Fantastic.
It didn't force me to make decisions, but it let me know that I was able to make decisions about my health, and you guys helped in that. Before we leave languages, I do want to ask one important question. How do you make it so that the patients that are receiving language services aren't just getting Google Translate from their phone?
Oh.
How do you do it so that they feel understood and not just translated?
So this is the moment of the interview where I have to give a humongous shout out to the entire team of interpreters that we have at Moffitt. And can I say their names?
Please. Definitely.
Because they deserve to be spoken about by their names. Rafael Cardona, Elisa Diaz, Jocelyn Balcom, Ninette de la Torre, Mónica Pérez, Shanta Ali, Amanda Rivera, Mirza Rodríguez, Keila Palenzuela, Cristina Nishikura, Manuel Barrera, our translator, Alex Gianazzo. So you probably have heard that Moffitt is the Cadillac of the cancer centers. This team of interpreters is the Cadillac, or maybe there's something higher up. I don't know much about cars, so the Lamborghinis, I don't know, of medical interpreters. And I don't really want to make a joke about this, because there is a very fundamental difference between our interpreters in this team and interpreters from other institutions. Our interpreters here work in the world of oncology. And you know what that means. It means complexity, it means humility, it means heart, it means compassion, empathy. But being compassionate and empathetic have to be alongside being very, very skillful at what you do. And the way that these individuals blend all of that in an encounter is nothing short of miraculous. Many patients have told us throughout the years of working here that having the interpreter in the room, connecting with the interpreter at that professional and personal level has been therapeutic in itself. There is something very healing at being able to recognize your own language in the room, to recognizing that someone else other than the medical professionals are on your team. I have witnessed something that was amazing. We had a patient who spoke another one of these languages of lesser diffusion. It's an indigenous language. There's literally maybe, 5,000 speakers. And she was in the head and neck clinic. And we had actually found an interpreter from the same region where the patient is from to match the dialect. I wheeled a video card into the room and I selected the language. And when the interpreter came online, I said, "My name is Prado Antolino. I'm calling from Moffitt Cancer Center and I need this particular language, but I need you to know that the patient is from this particular region. Can you match the regional variation?" And the interpreter immediately switched into the language. And the patient was sitting in the chair. It was an outpatient clinic, kind of leaning back, not understanding anything that's going on around her because she didn't speak English or Spanish. And out of the blue, the patient sits up with the biggest smile on his face. It was magical. It was magical. I would like to think that our patients do not feel Google translated, that they feel that the communication connection goes so much further than that.
Okay, actually, I'm going to ask you a technical question since we're getting into technical. Tell me about this Section 1557.
Very briefly, Section 1557 is the non-discrimination clause of the Affordable Care Act. We've had an Affordable Care Act passed since 2010. We have always had Section 1557. It has gone through several sort of iterations throughout different administrations, and there was a new rule issued in 2024 that expanded and strengthened the protections for language access and disability and communication. So this is a tricky question for me, Charlie, because maybe our patients listening to us think, well, so Moffitt is providing these services because the law requires it. But that's not really true. I mean, we do to some extent, but I feel like the law has finally caught up to the services that we have been providing for the longest time. So we have to be concerned about meeting the law and our obligations under the law. I'm the director of the department, I cannot say otherwise. But if you asked any of the interpreters, any of the accessibility specialists working in this area, any of the coordinators in the team, I don't think they're going to mention the law. I think they're going to mention because it's the right thing for the patient. And finally now, the law has caught up to that. I don't have to make the moral case for language services anymore. I can now make the legal case alongside the moral case. And the traction is all there. So thank you for asking.
Well, no, and it's good to know that Moffitt has been, on the cutting edge of patient care for decades now, pretty much. All right, so the law also mentioned, disability access. Whenever we talk about access, we think about ramps or interpreters or like accommodations. But like, what about some of the less visible barriers that patients can have accessing?
I was thinking about this question very objectively. And I was trying to draw from what our patients have taught us as well. And I think when we talk about access, a lot of times we talk about things we can see. And then there's a lot of other things that are really invisible. In our work at Moffitt with the outreach teams and with our patients on a day-to-day basis, you realize that a lot of people might be struggling financially, even though they are wearing whatever it is that we think are decent clothes or branded clothes or in other examples, like people do have housing insecurity, for example. And perhaps the way that they are set up in their housing circumstances or is not conducive to certain types of treatment. There was a particular treatment that required the patient to have the medication refrigerated, and they didn't want to share that their housing circumstances were so poor that they did not have access to refrigeration. And so there was a negative from the patient's perspective. They didn't want to engage with the medication, even though the medication was going to support 100% recovery and treatment. And so it could all, I wonder, have stopped right there at the patient has autonomy. The patient decides they don't want to engage. But of course, there was probing. There was an understanding that something else was at play. And then we got to the heart of the matter, and then there was help provided. So I guess to the invisible barriers, I think this is where maybe Moffitt excels so much. I feel that when you look at medical teams and ancillary services, social workers and others, really everybody. Patient savings, right? You've heard this so much. From the valet person all the way to my environmental services person bringing me food. I think there is this true connection with patients and this true putting ourselves in the patient's shoes. I would like to think that we are able to do the visible and the invisible in a very seamless way because of the hearts that we carry around.
Okay, that's a follow-up question to that. So, especially thinking about that example you just gave me of the patient that didn't have access to refrigeration and didn't want to share that they didn't have access to refrigeration. How do you help ensure that, as a cancer patient, I know that we already feel like we're a burden on our family, friends, and everything because of our disease. How do you help ensure that cancer patients with additional needs don't feel like they're an extra burden and more burdensome than we already do?
That is another really good question. And I think for the patients that we work with, and I'm sorry if this is a naive answer, the warmth that we bring into our jobs, the way that the interpreters connect with the patients, the connections that they make, the relationships that they make, I think transcends, hopefully, this sense of this is a business transaction between me, the patient, and this particular service that Moffitt is providing to me because the law says so or because it's the right thing to do or whatever the case might be. That was the best I could come up with to answer this very, very good question.
That's fantastic. Now, I want to learn a little bit more about Prado. 22 years, that's a long time to be dedicating. And so it's a natural question. What After 22 years, what keeps you coming back with this amount of passion?
The patients. Really, the patients. There are hard days in this job. I think there's no sugarcoating that. Sometimes when I'm feeling particularly discouraged, I decide today I need to refresh the meaning of being here. And I will go and take an encounter. And it completely resets the why. And, there are members of my team that are not in direct interaction with patients, but everything they do affects a patient. Every word they translate, every encounter that they dispatch the interpreters to, I feel like it's so easy to make this connection for my team, to keep them motivated and engaged. There is only one reason why we're here, and it is our patients. It might be the simple answer, but it is the answer.
Well, I'm gonna raise the level of difficulty to that answer and kind of flip it around on you. You've spoken about how you've influenced so many patients in their lives and in their process. I'm gonna ask you now about maybe if you can remember one or two patients that influenced you and had a real impact on you.
So when I started at Moffitt in 2003, I just aged myself. Obviously I was I was very green. I was hired as a translator. So written documentation is translation, interpreting is the verbal one. Okay, so that's a difference, actually important differentiation. And I had a dual role within the clinical trials office. So I would translate informed consents for clinical trials, and then I became the interpreter for those patients on clinical trial. It was a magnificent job. I just loved every minute of it. And there was a 27-year-old patient with sarcoma who had a 7-year-old daughter. She had a very, very, very aggressive type of sarcoma. And I was with her for the entire treatment, all the way to being sent home with hospice care. And I have met so many patients who are resilient, who are so strong, who teach us, all of us Moffitt employees, the true meaning of hope, of believing, of fighting. But I think this patient is probably the one that stuck the most with me. And I continue to carry her. I carry many patients in my heart, but I carry her very specifically. And I've spoken about her in other forums within Moffitt.
And speaking of hope, Moffitt is amazing at providing hope, by the way. It's one of the things that kept me coming back here, is it gave me hope for making it through cancer. What do you hope that whoever's listening out there, staff members, other patients, caregivers, what do you hope that they get from this podcast?
I hope they get reaffirmed in the idea that as they hear from different perspectives and different maybe professions within this big institution, that they are reaffirmed that no matter what's happening on a particular day, I think Moffitt team members always want the best for them. And that they are looking at them and treating them, hopefully, again, the same way that they would want their family members and their spouses and others to be treated. That for a lot of us, this is not just a job. And that's why there's so many long-term employees at Moffitt. But this idea that one person can make a difference, which of course is what Mr. Moffitt has taught all of us, is so true. It's so true, and it's still true to this day. And when you come from the world of translation and interpreting, which is not necessarily paid attention as, it's kind of one of those things. It's there, whatever. The fact that you come into an institution that is reinforcing this idea that everybody can make a difference and that everybody does make a difference is very empowering for the rest of us. That we really, really are rooting for them. We want everybody to come and be with us and then go home to their families and live their lives.
Thank you, Prado, and thank you for making that difference. You really have.
Thank you.
I appreciate it.
Thanks so much for listening. Please join us next month for episode 2 in our new series called Beyond the Barriers about patient access at Moffitt. See you then.